kansascity.com. And it says, Missouri Health Director kept spreadsheet of Planned Parenthood parents' periods. This article was done by Crystal Thomas, and you can check that out for yourself. We're going to get into this article, and it says St. Louis. The Missouri State's Health Director, Dr. Randolph Williams, testified at a state hearing Tuesday that he kept a spreadsheet to track menstrual periods of women who visited Planned Parenthood, an action that one lawmaker has called on the governor to investigate. The spreadsheet, which was made at Williams' request by the state's main inspector, helped to identify patients who had undergone failed abortions. The revelations came on the second day of the Administrative Commission hearing that will help decide whether Planned Parenthood could keep its license to perform abortions. Kansas City, I'm sorry, that's another story. Williams testified that the investigation of the Planned Parenthood began after state inspectors found evidence of a failed abortion that didn't have a corresponding complication report, logged with the state. The spreadsheet, which was based on medical records that investigators had accessed during the state's annual inspection, also included medical identification numbers, dates of medical procedures, and the gestational age of the fetuses. Oh man, that is too personal. The last column of the spreadsheet included the date of their last menstrual cycle of each patient, calculated by the health department. The patients' names were not included. Like, that makes any difference. They got the ID number, they got you. The investigation eventually found 4 patients that had to return Planned Parenthood more than once to have a successful surgical abortion. The failed abortion led the department to have grave concerns that caused it to withhold the St. Louis clinic's license. Williams, who was an expert witness for the state, was questioned by one of the Planned Parenthood's attorneys, Richard Amunez. The spreadsheet was attached to an email sent between health department employees with the title "Director Request," and found that legally discovering the subject line of the email was duplicate ITOPS with the normal menstrual date. The Missouri House Minority Leader has called on Governor Mike Parsons, a Republican, immediately investigate whether patient privacy was compromised or laws was broken, or whether Williams was a person who Missourians can be comfortable having in a position of public trust. The state law requires the health department director to be of recognized character and integrity. State Crystal Quaid D. Springfield said in the statement. I'm just going to cut that down to Springfield. This unsettling behavior calls into question whether Dr. Williams meets the high standard. Shortly following the hearing, the head of the St. Louis Planned Parenthood said she found the spreadsheet deeply disturbing. This is a government overreach at its worst. Rodriguez, CEO of the Reproductive Health Services of Planned Parenthood of St. Louis region, said in a statement, it shadows the Trump administration history of tracking periods of refugee girls, the government's care. This is outrageous and disgusting. A request for comment from the Department of Health or Senior Services was not returned, and the Attorney General's office declined to comment. Citing ongoing litigation, Williams, an OBGYN, was appointed director of the Department of Health and Senior Services by former Governor G in 2017. Previously, he served leading positions with the North Carolina Health Department. Oh wow, yeah, down there too. Williams, during a testimony that there has been a false narrative propagated that the investigation of Planned Parenthood was a top-down initiative. Williams, who testified he was pro-life and he had never performed an abortion, was paroled to the state's investigator as he provided some of the medical knowledge to investigators for flagging issues with care of the 4 patients. One of the obstacles that kept the state from completing its investigation was not being able to interview some of the physicians who had helped provide care. Those physicians were medical residents of training or fellow placed at the clinic or on rotation, which meant Planned Parenthood could not compel them to cooperate. However, the 2 physicians agreed to be deposed by the state in the licensing dispute. Williams said the issues presented at the clinic, which were listed in the statement of deficiencies, were eminently flexible. Because we now talk to the clinicians that took care of those patients, we are very, very far along on feeling we can improve that care with some new policies that we can collaborate with them to implement, Williams testified. Williams drew national attention early this year over the state policy requiring that the physicians perform a pelvic exam 3 days before a woman receives a surgical abortion, even though physicians already do exams immediately before the procedure. And it goes on for some time. Basically, this was a person that was put in the public trust, and he violated the public trust. Literally keeping spreadsheets, like, let's think about that for a moment. Spreadsheets usually come up when you come into accounting, or you're doing like your little office company, football league, basketball, you pick the sport and insert the name, whatever, you know what I'm saying? But on this, something this personal, this private, something that a woman has the right to do and has done since Roe versus Wade. It's crazy. It still boggles in the mind. It's like 2019 about to be 2020 in a month or so, if you're not keeping track. But this is crazy. Let me know what you think about in the comments. Let me know how this make you feel as a woman. I mean, anybody can comment